So now we're going to be talking about types of dementia. There are a number of different ways with which someone can experience cognitive impairment, and this certainly isn't an exhaustive list. So there are things like tumors, traumatic brain injury, etc., developmental disorders that can cause cognitive impairment as well. We're focusing on the dementia type cognitive impairments. So as you can see here, the primary one that we experience or run into in practice is Alzheimer's disease or Alzheimer's dementia. So up to 80% of individuals who have dementia as older adults will have, at least as part of their component of their illness, Alzheimer's disease. It is fairly commonly comorbid with other types of dementias, but is that characteristic progression of short-term memory loss, of things like names, conversations, details, but then progresses over time, usually several years to a few decades, to things like confusion, changes in ability to make appropriate judgment and behave appropriately to society. Which results in overall functional decline, inability to participate in activities of daily living, and will ultimately result in death. And this is largely caused, we believe, by beta amyloid protein accumulation and these like kind of neurofibrillary tangles that are caused by changes in tau protein. So again, that course is usually about 5 years to a couple decades from their diagnosis, but it does tend to have a bit of an insidious onset. So individuals may not report symptoms of their mild cognitive impairment until they've been symptomatic for some time. Vascular dementia is a little bit different because the symptoms tend to have a fast onset, as they are the result usually of some sort of cerebrovascular disease. So there's hypoxia of brain tissue that results in loss of that functionality. So it could be after, say, a stroke, for example. And about 5 to 10% of individuals who have a diagnosis of dementia have this as a component of their experience. And the typical presentation of vascular dementia includes the slowing of thoughts. So they have a hard time formulating their thoughts and making decisions. They may have other kind of post-stroke type signs and symptoms, such as changes in gait and balance. They may lose emotional expression or become apathetic. So this is typically managed through risk reduction. So things like statins, aspirin, etc., because of the etiology of vascular dementia. The course is quite variable because it is a singular onset or could be a number of different events that occur. So it doesn't have that kind of slow progressive nature that we see with Alzheimer's disease. We have dementia with Lewy bodies, also sometimes referred to as Lewy body disease. It is associated with Parkinson's disease, but does not have to occur at the same time. And it's about 5% of individuals with dementia. Now, this is a little bit unique in that it is earlier on in the illness characterized by things like hallucinations, significant disturbances in sleep, signs and symptoms of delirium, some Parkinsonian symptoms as well. And this appears to be from a product called alpha-synuclein, and that aggregates or kind of clumps up within the cortex, that outward part of the brain that helps to filter and associate stimuli from the environment. This tends to have a more rapid progression, so time from diagnosis to really death is usually just a few years. So it tends to be a little bit more compressed in terms of duration of illness. We also have frontotemporal dementia, which is in the frontotemporal lobes, right? That makes sense because of the name, and that's about 10% when we're looking at early onset dementia. So this typically happens in individuals who are less than 65 years old, but it can happen later on as well. And the characteristics of frontotemporal dementia include behavioral and personality changes, language like difficulty finding words or mixing words up, changes in eating habits, disinhibition, so being a little bit less privy to societal norms, changes in the individual's social skills. This also tends to have a fairly rapid progression where onset to ultimately perishing is a handful of years. We also have this kind of unique one, hippocampal sclerosis, which in our older adults we see in 3 to 13%. The numbers are hard to know for sure, but this is specific to the hippocampus, which is the thing that stores our memories. So the hippocampus will shrink and harden, and essentially it's difficult for that individual to form new memories. Now, we do see this comorbid at different stages of life too, when we run into individuals who have certain forms of epilepsy. So seizure is part of the manifestation a lot of times of hippocampal sclerosis, but also manifests, of course, as memory loss because it is part of the hippocampus. Now, the prognosis for this one also is quite variable, depending on the severity, the etiology, how it's managed, can really impact the prognosis for hippocampal sclerosis.